nothing beats that feeling of knowing that you've saved somebody's life.
SMA Healthcare is primarily a behavioral health provider. Services on the spectrum from crisis stabilization all the way through outpatient services. Anything that a person might need for a behavioral health or substance use crisis, we would be able to treat that.
A lot of homeless and people who are dealing with addictions come through our services, especially at Beacon Point. They stay up to 72 hours for observation. We have the CAT team, which goes into the home and tries to stabilize families when there's child welfare involvement usually. Anyone can receive an assessment to see what services they might need, and we will get you into the appropriate service array regardless of your ability to pay.
All of the treatment plans that we formulate with folks are completely individualized, so they're tailored to meet that person where they're at and what their specific needs are. So we have crisis services both here in Marion County and in Volusia County. Here in Marion County, we have the 3 units. We have the adult CSU, the children's CSU, and the adult detox. Over in Daytona Beach in Volusia County, we have the adult detox and an adult CSU. And just like here in Marion, that's open 24/7, 365.
There's such a stigma when it comes to mental health and substance use treatment. A lot of people really are fearful of interacting with a therapist or a case manager or a nurse practitioner or doctor because they're afraid that what they might say could be embarrassing, they might be looked down upon. The reality is that mental health disorders impact about 1 in 4 people in the United States. So if there's something to be said, we've probably heard it before. And we really try to normalize that this is a place where you can come to feel safe talking to people, and that whatever you say stays confidential in that room as long as it's not going to seriously hurt somebody or that person themselves. But otherwise, we keep it a very safe environment for people to talk about whatever they're comfortable talking about so that they can get the help that they need.
What we do at SMA Healthcare and in crisis services is so important. And what drives me, what really fuels me, is making that difference in a person's life where when they get to us, they are in their deepest, darkest place they've ever been. And then when they leave our care 5 days or so later, they're themselves again. And it's got to be one of the most beautiful and amazing things I've ever seen.
We always are looking for new revenue sources. We actively seek grants. We've been very fortunate to receive several grants over the last few years from SAMHSA, which is the Substance Abuse Mental Health Services Administration. Volunteers, interns, we offer opportunities for anybody who wants to get involved in what we do. There's a way to do it. Our website is smahealthcare.org. Our website has all of the information that a person might possibly need, whether they're looking to receive treatment and they want to know about our locations or the services that we offer. It also offers information about the SMA Healthcare Foundation, and the SMA Healthcare Foundation is the fundraising arm of our agency to ensure that we can continue providing the services that we do in the counties we serve.
People think that folks that have mental illnesses are broken. People believe that folks who have substance use disorders are somehow bad people, or they're the victims of their own bad choices. And we know that this is not true. These are illnesses like any other illness. They're diagnosable, they're treatable, they don't make a person less than anybody else.